Hello, welcome. If you are just joining for the first time, welcome. I'm Dr. Meghan. I am a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. And this channel, this place, this stream today is for evidence-based answers to your weight questions. Today, I'm answering some great questions that you all sent in. This is a place for you if you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions. So let's get started. Thank you in advance for these great questions. All right, let's see. And then before we get started, as I always do, just a caveat, I can't answer personal medical questions because I'm not your personal doctor, but so if it does skew a little personal, I'm gonna change the question a little so it's broadly applicable for educational value. All right, so let's see. First one is a question. This is about Tirzepatide. I have been on Tirzepatide 15 milligrams for almost 2 years. My A1C has gone down from 11.8 to 6.1, but have not lost 1 pound. Yes, I hear you. So this is something you definitely want to check in with your physician about, but in general, we do know that it is more difficult for patients with diabetes. So this person is talking about their diabetes marker, their A1C. Ideally for anybody with diabetes, we want it to be 7 or 7.0 or under. You officially have diabetes if you have 2 consecutive measurements of 6.5 or above. 2 separate measurements of 6.5 or above. So they've moved from 11.8, which is very clearly in the diabetes range, to 6.1, which is in the pre-diabetes range, which is excellent. That's great. And it doesn't mean that somebody doesn't have diabetes anymore, but it does mean their diabetes is much better controlled. So well controlled that if this was the first number we tested them on, and they weren't on medication, they would not be in the diabetes range. So anyway, the point is excellent control on Tirzepatide, but they haven't lost any weight. And this is the story for many people, actually, that it is much easier for patients who have overweight or obesity and don't have diabetes to lose weight than it is for patients who have overweight and obesity and have diabetes. So while many people do lose weight who have diabetes on Tirzepatide, it's pretty much the most powerful thing we have medically at this moment in time. For some people, it doesn't work well in terms of their weight. For people with diabetes especially. It's just a lot harder for people with diabetes. So the first thing you want to do is check in with your doctor, make sure there's nothing else interfering. And then you can also think about potentially maybe some other medications if you would be an appropriate candidate. But it's clearly working for your diabetes, just not helping you as much with your weight. Depending on where somebody is with their weight loss as well, and depending on kind of where their BMI is, and it really depends on the patient. If somebody's very resistant to medications, this is also a great time to check in with a bariatric surgeon to see if you would be a candidate. That's always a great direction to think about as well, if for somebody that it's medically appropriate for. So thank you for sharing that. I'm so sorry that you have not had expected weight loss on it, but it is more common for somebody with diabetes to struggle to get their weight down than it would be for somebody who didn't. So good luck. Thank you for sharing. Next question. I took Topiramate for epilepsy, but it wasn't helpful. Now I'm on Keppra and Lamictal. The VA has offered Tirzepatide for weight loss. Is this the same thing? No, it's not, but great question. So Topiramate is an anti-seizure medication that can be used off-label, meaning that it wasn't originally approved for this by the FDA, but we do use it for many different things. And one of the things that we use it for is for weight loss, and particularly as kind of an adjunct medication to help. Maybe somebody's already on something, but their BMI is not quite where they want it to be for health reasons. So you can think about adding Topiramate, and you may get another 5 to 7% weight loss from that. But it definitely was not originally approved as a weight medication. Tirzepatide is a GLP-1 GIP agonist, which was approved for weight loss on its own. So they're very different medications, and hopefully, and I made separate videos about both of them, so hopefully that's clear. Topamax anti-seizure medication, sometimes we can use it for weight loss. It's an oral medication, not as powerful as the other medications we have, but sometimes can be really a nice kind of booster. And Tirzepatide is an injection once a week, very powerful weight medication. So, and then Keppra and Lamictal are two medications it sounds like this person's on. Those are both anti-seizure medications. So these are 4 very different medications. So I would definitely chat with your physician about pros and cons of Tirzepatide and whether that would be appropriate for you, but it's definitely a different medication than the Topiramate. Okay, so next question, I think this isn't sharing. All right, this is somebody who's on one of the injectable medications, I believe. My early weight loss in the first week was food in my intestines, with it balancing in the second week, filling up with the use of Metamucil to help prevent blockage. I was stabilizing, track my weight, calories every day, not overeating. Yeah, so what this person is saying is that they definitely were having some constipation and were using some Metamucil to help prevent buildup of constipation. Which is, you don't want that. So it sounds like they worked it out with some over-the-counter medications. That's great. Thank you so much for sharing. Yes, so definitely how you feel in week 1 is not necessarily how you're going to feel in week 2. And be on the lookout for those side effects. And sometimes they're very easy to fix. So good luck. Thank you for sharing. Next question. What to do if all of a sudden someone has major health issues from Ozempic and then Mounjaro? I've never had these issues. I'm going to shorten this a little. Pain from kidney stones, kidney infection, diverticulosis, maybe diverticulitis. Diet is excellent. Just reached the highest level of Mounjaro. Avoided extreme bariatric surgery, averaging 3-pound weight loss. Began calorie deficit. Great. Bedridden for many years prior, gained 100 pounds from bedridden and depression. That's great. Okay. I'm only 65 pounds away from healthy BMI range for me. Oh my gosh, terrific. So thankful for Mounjaro. Ozempic was not good for me. Okay. Okay, so the gist of this, and correct me if I'm wrong, the gist of this is somebody was on Ozempic and then on Mounjaro. It really, really helped them, but now they're having these new medical issues, and such as kidney stones. Yes, so usually kidney stones can be less likely to happen, but certainly can happen with significant weight loss. More likely to happen with the oral medications. Gallstones are definitely more likely to happen with any of the significant weight loss medications, but or it could just be that they incidentally had kidney stones while they were on this medication. But either way, it's not like one of the primary things to think about, but certainly if people have fluctuation in their hydration status, that can come up. It's not, it's definitely not going to happen for everyone, and kidney stones don't happen as much, but they're definitely within the realm of possibility. So definitely check in with your doctor in terms of making sure there's nothing else that you think is contributing to that, and see if there's any other culprit. But yes, the short answer is that, nothing is ever like 100% good and then there's no bad, right? When we have medications, there's always side effects from medications. But if you don't take medication, there's side effects from not taking medication. So it's always a balance between the risks and the benefits. So definitely chat with your physician about what do we think the primary cause is from these kidney stones. They might tell you that, there's nothing else was going on, so it's probably maybe linked to your hydration status on these. Sometimes people get really dehydrated. You definitely don't want to do that on the injectable medication. So, and it might be time for you to switch to something else or not. Sometimes people have to see urology. It really depends on what's going on for that person. So the bottom line is that you, of course, in improving many aspects of your weight, there may be other side effects as well, and we know this can happen, and it really just depends on what the side effects are and if it's worth it for you, if you can manage it, and if it's not, sometimes people need to change to a different medication. So good luck. Thank you for sharing. That's going to do it for today. Thank you so much for all your questions. If you have questions after this, please leave it in the link down below. And if you want to work with me directly, you definitely can. I will leave that information down below as well. Thank you so much for watching, and please be well.